Good morning, everyone. It is my honor to be invited to talk about university social responsibilities, respond to COVID-19 full community engagement at the International Healthcare Conference organized by Fu-Yin University in Taiwan. I know the conference theme is about continuity of care across lifespan and sustainable development. So today, my examples are also related to the care for the seniors. Let me introduce myself. My name is Carol, Associate Professor and Head of the Gerontology Program, Senior Fellow of Center for Experiential Learning at Singapore University of Social Sciences. With the pandemic, we all experience a lot of changes in our life, from normal to new normal, and how to adapt the new normal till today. Every day, we are trying to meet the changes. Yes, our world is changing. These are the examples for us to think of new businesses, new network, new connection. For example, Uber is the world's largest taxi company, but it does not own any taxi. Airbnb, the world's largest accommodations provider, but it does not own any real estate. Netflix, the world's largest movie house, but it does not own any cinema. There will be more different kinds of new business and even challenges in this changing society. Coronavirus is one of the challenges in the whole world, but it also gives us a chance to think of our life and also think of what we can do more in the world. People said that we are all living in a VUCA world. So what is VUCA? VUCA stands for volatility, uncertainty, complexity, and ambiguities. It is a term to cover the various dimensions of the uncontrollable environment. With this uncontrollable environment, what's the meaning of social responsibility? What's the role of our higher education? How can we practice university social responsibility? I remember that I was invited to give a talk in 2014 together with the UNESCO Chair in Community-Based Research and Social Responsibility in Higher Education in Korea to talk about university social responsibility. More and more universities have integrated social responsibility vision in their strategies. They are working in a triple dimension, including economic, social, and environmental, and at the same time undertaking specific actions in each structure across 4 sections, including teaching, research, management, and projections to society. So these are the 2 books that talk about university social responsibility. I have 1 chapter about how knowledge and engagement in higher educations of our Asian countries. One of the sponsors of the book is called GUNI, Global University Network for Innovations. It has mentioned the importance of the role of higher education nowadays. And universities are well positioned to link the local and the global and to give them considerable access to an influence over change process in the society, because this can enhance their potential to contribute to human and social development. And the role of higher educations, we actually play a critical role in creating educated and responsible citizens, because we need to develop partnership and co-create knowledge that can serve humanity. The ultimate goal is to develop a sustainable community. So how can we do that? So we have 3 areas that you can consider, which are engaged service, engaged teaching, engaged research. So from engaged service, you can consider how you can cultivate giving cultures, promote service leadership, promote university social responsibility, and provide a platform to do lifelong learning. Engage teaching, building applied learning, surface learning, problem solving into pedagogy, and address the need of the community. Engage research, community-based partnership and apply research that can serve the community. Some universities use surface learning and community engagement as a way of doing the university social responsibility. We can see that there are many institutions around the world are using knowledge, surface learning, and community engagement to serve the society. If you want to know more about what they try to integrate knowledge and engagement in their institutions, you can refer to this book. This book actually has a lot of cases in Asia, Africa, Central America, Europe, Middle East, North America, Pacific, and South America. So if you try to get this book, then you will know more about case. As I mentioned, I also have one chapter in this book. In Asia, there is a rapid development of service learning and community engagement as well. So you can see there are many institutions around Asia. They also are interested to do service learning and at the same time to also serve the society in order to showcase their university social responsibility. So in the whole world, there is also a growing institutional engagement. So you can see a number of university here. And other than university, even regional network like Europe Engage, Taras Network, CLIES from Argentina, and non-profit organization like Touch Community in Singapore, they even have a service learning team. UNESCO for social and responsibility, and also Global University Network for Innovation. And the reason why that so many people are interested in community engagement and service learning, it also because there is a growing interest in engaged service and teaching, that is academic service learning. So we see a lot of university, they start with doing community service, and then they develop their community service into academic service learning, wherever term-based, summer-based, or even afterward expand to yearly base. And then they also incorporate research into the academic service learning program. And then afterward, they evolve into social innovation, social entrepreneurship project. So at the end, what they want to do is to promote lifelong service learning experience and also social responsibility among teachers and also students. So all of this are all linked to different discipline. Because if we want our students to serve the society, and the best way is to use their learned knowledge and then to serve the community. Because we also believe service combined with learning add values to each and transform both. So here a list of discipline-based service learning. And so you can actually take a look. Even though you are in environmental study, philosophy, nursing, history, Spanish, political science, biology, teachers' education, women's study. So that means if we have a university, right? If as long as you have different discipline, you can also embed service learning and use it as a way to connect with the community. And then the community become a classroom that our students can learn from the community partners and even their service target. So other than engage service and teaching, we also see growing interest in engaged research, and more university they also publish work related to service learning and community engagement. They also use the discipline research and then to publish paper. So you see a number of paper here also related to service learning, and then here one paper even related to COVID-19 in a Chinese context. So in response to the pandemic, How can we create more engaged university to serve the needies? One of the alarming number nowadays are the death rate case and the confirmed case during the pandemics. Other than vaccination, what other thing that we can also support people's in social and psychological well-being? Here actually is another fact. The vulnerable group, seniors, has a higher death rate during this pandemic. So how about your country? Think about it, what you can do for them. The impact of COVID-19 on older person are getting serious, especially in economic well-being, mental health, life and death, vulnerability, abuse and neglect, and some of our older person are not just victim, they are also responding. They are also health worker, carer, and among many essential service providers. So how we can work together to support our senior? What can we do as an institutions, as an educator, as a students in response to the needs of the older person during the COVID-19? Singapore University of Social Sciences is one of the 6 funded university in Singapore. Our vision is to lead university for social good. So we have a lot of program also targeted to social good. And our purpose is to inspire lifelong learning, transform society through applied social sciences. So we work closely together with our community to develop different kinds of applied learning experience to our students and also to help the community. And Singapore University of Social Sciences, SUSS, is also the first university in Singapore to offer gerontology program. In view of the rapid population's aging, we realized that we need a team to collectively address the aging issues and challenges in Singapore and even in the region. So we set up the program 11 years ago. Our vision is towards professional excellence and leadership in gerontology. Our mission is to develop people who can positively impact the life of our older person. As a group of gerontologists, what are the responses to the COVID-19? So, we have a group of alumni, students, faculty members, and community partners. We work together in a few areas. The first area is about engaged service. We organize a series of seminars to care for caregivers, seniors, and workers. We partner with organizations like People's Association and Sport SG because we understand that many caregivers and seniors are under a lot of stress during the pandemic. So SUSS faculty, alumni, and students line up with different organizations, organize a series of seminars focused on health and wellness silver series for the public. In order to get more family to join us, we even teach the senior and family how to use Zoom to attend the virtual seminar. Other than seminar, we also have sport trainers to teach us how to do exercise during the pandemic. So if you want to know more about the content of the seminar, you can refer to our SUSS Gerontology YouTube channel. Here is the link. One of the seminar is about Silver Talk Show. So we invited senior to join us to talk about their feelings of pandemic. So our participant, who is 73 years old, shared about her feeling. She said, C is for connecting, O is oneness, V is visualization, I is insight, D is dormant. If we could all connect and collectively see the oneness of humanity, if we could take time to sit down quietly and visualize the whole of humanity coming together, visualize the virus going back to where it had came from and remain dormant. This is a very powerful technique to heal the world of the present situation. So this is the wisdom from our senior. Her sharing inspired to other seniors and family to continue to join our seminars. Other than the silver seminars, we also organize a series of seminars for professionals. How we can care for our elderly during COVID-19 pandemic. We have invited speakers from Singapore, Taiwan, Hong Kong, and Beijing to share their best practice to take care of seniors during this pandemic. We also invited the former chief of UNESCO to talk about aging policy development in Asia, and invited the founder of Aging Asian Alliance to talk about aging and business opportunity. The series of seminars have over 200 people from around the world to join us. Of course, the major one is the partnership with our National Library Board, which we have outreached more than 10,000 people. We hope to take the opportunity to celebrate the International Day of Older Person and the 10th anniversary of SUSS Gerontology program. So our students, alumni, and faculty join hands to coordinate different sessions in terms of opportunity and challenges of lifelong learning for senior, ageism in our society and workplace, gerontechnology, and startup opportunity. So in 2021, we even envisioning meaningful aging together. We thought we can actually do it face to face, but because of the pandemic, we have to organize it online. But we asked ourselves, how we can make this online seminar different from the previous one? So we create more experiential learning activities with caregivers and seniors through virtual reality. So we have different tours for seniors to go. Yeah, we also introduce different retirement resorts. So again, if you are interested, you can go to our channel. Yeah, and other than that, we also advocate seniors' voice and envision meaningful aging together. We also create a platform to support each other and do exercise together. Another key event that we have organized is to bring the first virtual Chingay event to all the frontline workers, senior, and caregiver. We partner with People's Association to host the first virtual Chingay party. The word Chingay is equivalent to the Mandarin word Zhan Yi, which means the art of costume and masquerade in the Hokkien dialect. Here in Singapore, the Chingay Parade started in 1973 as a street parade to celebrate the Lunar New Year's. Since then, it has evolved into an annual iconic event that showcases Singapore's rich and unique cultures. So we partner with different nursing homes. It also brings back lots of memory of our participants. So this is a special program with over 28 nursing homes and community hospitals from Singapore, Hong Kong, China, Taiwan, Malaysia, and Japan. So we also organize virtual Lohei. Yeah, and that means we can 风山水起, 水起. Yeah, and then so we also sing Chinese song together. We play game together, even though we have senior there in nursing home, because all our students, alumni, and also community partner were on site. Yeah, and then to help and support the technical in the nursing home. So we sing Chinese song together. We celebrate the Chinese New Year, 2021, the year of the odd. And here are the pictures of different nursing home who join us. You see the elderly, they wear in red because they like the events. Yeah, and then here are some highlights of the pictures where senior cannot, get out of the nursing home, but they can still see other people from the virtual world. All our senior faculty members and students try to connect each other's, in the site. It is really a meaningful program to many seniors. Some of them, they even told me they don't want to sleep because they want to continue to watch more program. Yeah, but because they have a sleeping time, so they have to sleep. Yeah, and so they even gave hugs and support each others during this time. We also acknowledge and appreciate each other's care and support during the pandemic. Other than that, we also have various engaged teaching program during the pandemic. We work with different stakeholders to care for senior and supported organizations. So for example, we have a course aging family, multi-generational and cultural issue. Yeah, and then we work with Ministry of Health Holding to design activities in a new public housing with assisted living design. We also have a course dementia care that we work with a hospital to design a series of VR story for patients with dementia. And then the hospital also use it as a pilot for their patient with dementia. And then we have course about program planning and evaluation. Then our students also work with organizations like SG Asset, Bright Vision Hospital to develop program evaluation framework. We also have a group of students taking the course Lifespan Development and Psychology of Aging to understand about the stress and also the impact of COVID-19 on seniors, caregiver, multi-generational families, and about the community. So based on this academic service learning, our students learn a lot, and the project that they have done also share with the community partners too. And in the area of community engaged research, during the pandemic, we also partner with National Archive of Singapore and Dementia Singapore to work on a project called Reminiscent in Dementia Care Through Oral History. Do you know that in the whole world, every 3 seconds, we have one person being diagnosed with dementia? In Singapore, 1 in 10 aged 60 or above may have dementia also. So we also noticed that this is a more challenging time for caregiver and person living with dementia. And according to lots of study, yeah, in 2020 and 2021, yeah, person living with dementia are more likely to be impacted by COVID-19 due to social isolation, anxiety, and confusion from their various news, yeah, in the media, as well as the inability to remember important protective measures and instructions due to their cognitive impairment. And caregivers are also more likely to feel cut off, overwhelmed, yeah, and anxious as their burden of responsibility increase. So we are thinking about, we also ask ourselves, what kind of support can professional and the community provide during the COVID-19? Are there any programs that can be implemented to improve or maintain the quality of life and well-being of both persons living with dementia and their caregivers? So the three organizations working together to care for the caregiver and person living with dementia. How we do that? We visit each family for 9 sessions to conduct oral history interview with them. We have a team comprised with medical doctor, social workers, gerontologists, oral history specialists, video producers. Yeah, we use life course approach to find out their life history and use person-centric approach to pick the topics together with caregiver and person living with dementia. And at the end of the project, we co-create together with the family to develop the videos. Throughout the process, we use 5 senses and other objects to trigger their memories. The National Center for Geriatric and Gerontology in Japan proved that when we're talking about the past, the blood flow to the brain increase up to 80 times. So when we do reminiscence together, it triggers person living with dementia's memory, and they feel excited and want to continue to talk about their stories. Here is our approach, adapting oral history methodology for one-to-one reminiscence. before actual interview, we need to have a project details, preliminary interview, which help us to craft the questions. So as I mentioned, we use person-centric and life course approach in order to identify different thematic issues that we can discuss and talk to the caregiver and person living with dementia. We also look for reminiscent object to trigger memory, draft interview questions, explain the interview agreement for audio and video purpose. We also involve more than one person other than caregiver, and then person living with dementia, interviewer, and then we also have someone to be there to do video and audio recording. Yeah, other than that, at the end, we also do reflection and co-create of the knowledge. During the interview, we do recording and documentation. After the interview, we need to work on the case file, writing synopsis, transcript, updating database, as all the audio and video will be deposited to our National Archive of Singapore with the consent from the family for preservation purpose. At the end, we will disseminate the video and audio recording to the family to celebrate their loved one's story and legacy. We are thinking to organize a party for the family to get together and share our memories to the public. This will serve as an understanding how to see from the lens of person living with dementia. And here are the example of the generic interview outline that we develop for each family. And we follow up with more questions during our interview and preliminary interview. This is an example to talk about the background information in terms of marital status, age, family members, occupation, residence, and etc. And growing up years, social and recreations activities. Madam Tan is one of our participating elderly. She is 79 years old. She is a lady with strong resilience. She was a nanny, seamstress, trainee, and then become as a professional seamstress. Every time when she know that I will come, the day before she will ask her daughter to do makeup for her on the interview day. She pick up her own clothes, and this set of clothes is made by her. Such a lovely and beautiful ladies. And when I talk to her, she can tell me clearly about her story. Here are her wishes to join this project. She wants to smile, always smile, no Parkinson, can work properly, can have a good sleep, yeah, get someone to talk to, yeah, can participate in activities and no COVID, and speak clearly, and also can see clearly, strong and healthy. These are the pictures that, the time she made clothes for herself. Yeah, you see from the beginning that how she do. She even know how to measure, and she said she will also help me to make one clothes. So next time, if you come to Singapore, I can, wear the clothes to you all. Such beautiful ladies, yeah, and also still remember how to make the clothes. We are trying to educate people. Don't underestimate the power of person living with dementia. Try to see from their lens and let them tell you what they want to do. We are preparing a mass training to train more volunteers to conduct this kind of interview for the family. We hope to equip more people to understand dementia and reminiscence. Because we all share these thoughts. If I knew I would be diagnosed with dementia or were in my end of life stage, I will hope to preserve as much as I could, including my cognition and of course to maintain my autonomy. So, how about you? After listening what we are doing, do you want to do something with us or do you want to start similar project? The work that we are doing during the pandemic inspire a lot and also inspire us to do more in the future. So we are planning to set up a national memory bank and hopefully we can get more people to join us. As I mentioned, we train more people to collect story. We hope that we can have more people to join us to do oral history for their loved one and also for the senior. We also use the same approach and then to understand from the lens of our seniors and record their loved ones needs and want and deposit in a national memory bank. So this is one of the proposals that we are planning to do. And other than that, this also inspires us to do more in the service learning area. Yeah, because we noticed that a lot of service learning pioneer, they are also getting old. Yeah, one of the pioneer is nearly 90 years old. We think that would be good for the young generations to work on the project together. So Singapore University of Social Sciences, together with International Christian University, we are planning to do a project called Intergenerational Conversation, Oral History in Service Learning Development in Asia. And this actually is a project that we learned from the States. Yeah, and so I was honored to participate in one of the service learning history project archive, yeah, at Stanford University. And then we think that it will be good. We can also do one for our Asian. So if you want to join us, do let me know. Can write to me, and we welcome if you come and join us. If your institution want to join either oral history in service learning or dementia care. Again, university is an important vehicle to connect to the community. Let's get our faculty members, staff, students, alumni to work closely with our stakeholders to create a better community. So there are lots of things that we can do during this pandemic. Look forward to hearing more from you during the Q&A. Once again, thanks for the invitations to let me share about the importance of University of Social Responsibility and the work that I'm doing in Singapore. If you have any questions, please feel free to email me anytime. Thank you very much.